Namaste, I am Dr. Dheeraj. Have you heard of a condition where a person slowly goes blind, not suddenly, but gradually, over a year? That's retinitis pigmentosa. Today, we'll uncover what it is, how people affect it, and what are the treatment hopes lies in Ayurveda. RP basically it's a genetic disorder. It destroys our retina. Retina is a light sensitive layer situated back of our eyes, and this retina made up of 10 different layers. Out of 10 different layers, one layer called photoreceptor layer. That photoreceptor layer made up of two different cells called rod cells and cone cells that we all studied in our schooling. Rod cells are responsible for dim light vision, scotopic vision, and more rod cells are distributed sides of the retina. The cone cells are responsible for color vision, sharp vision, and that more dense in center of the retina. In retinitis pigmentosa, initially the rod cells degeneration start. Eventually it affects cone cells also, but in some condition, like depends on which gene is affected, variation may happens. The main problems RP patients facing, first is night vision problem. Patient very difficult to see, sometimes unable to see in the dim light. Second is peripheral vision loss. Patient vision become tubular vision. Many of the RP patients suffering like they can't cross the road because the vehicles from the sides they can't see. They can't drive. Sometimes vision, along with the vision problem, some other issues are there, like patient may mute and deaf. There's a group of abnormalities that we call syndromes, like example Usher syndrome. In Usher syndrome, patient RP, retinitis pigmentosa will be there along with the patient unable to talk and they can't hear, mute and deaf. So many investigation tools are available nowadays to diagnose RP. First is ERG, electroretinogram, how the retina responds to the light, and absence of light, how the retina responds. All will come to know that. And the second is perimetry. Perimetry means the patient side vision, how much percentage patient can see the periphery, that we will get a proper picture. And third is OCT, ocular coherence topography, the retina thickness and how the vessels and all will get a proper picture. And the fourth one is, we all know, genetic test. In Ayurveda, we consider RP as Nakulandhyam or Kapha Vidagdha Drushti. Those are the names we can find out from the Ayurvedic classical textbooks. As for my experience, in RP, patient vision we can preserve. Whatever the vision patient having, that we can stable. For that, specific treatment modalities are there, like we call Netra Kriya Karmas, Tarpanam, we collecting ghee on the eyes, we do Shirodhara, pouring medicated oil or decoctions over the head. Specific eye drops are there, Anjanam. Like that, Netra Kriya Karmas we used to do along with the Panchakarma treatment. And another one important thing is, we will repeat the investigations like perimetry and OCT once in 6 months or once in a year. Then we analyze how the eye condition, whether the vision is stable or not, or vision improved or not. Like that, proper monitoring is needed. These are the possibilities with Ayurveda in retinitis pigmentosa patients.